Getting the vaccine today, for me, was a no-brainer. Um, with having worked through COVID thus far, seeing up close and personal the devastation that it has caused, and knowing the risks that are out there, once something like this vaccine has been provided, for me it's a no-brainer. I just had to take it. For my personal protection, me, my family, my grandsons, delightful fellas, I have got to be around, and I cannot risk passing it on to them or anyone else, be it patients here, in the hospital. That's my primary concern. I can't, I can't live with that.
There's a lot of people on the fence about getting a vaccination, and I can give them my feedback of my experiences. That way they can help people make a better decision for themselves. It protects my family, so that's the biggest thing. And then I don't want to wear a mask anymore, so.
I'm just really proud to do it. I feel like it's such an important thing to do for the country. I'm so thrilled that this hospital made the opportunity for us and that they've gone to such great lengths to give us the opportunity. So I'm very proud and very happy.
For the whole world, for the 300,000 people and more who have died from COVID, for the children who lost their parents, for their loved one, for the crying world because of what COVID had done 2020. If I as a doctor don't do it, who is gonna do it?
Because of the risk. And I am 63 years old. And, and in the ICU, I'm directly involved with the patients with respiratory issues and things.
I actually have a personal experience. My grandmother died of polio, and she didn't have the vaccine. So I'm a strong proponent for vaccination, and I think it is very a safe and sound method to prevent infection, whether it be flu, influenza, COVID, what have you.
That's how studies start. There's positive people who step out on faith and try it, and I want to be one of those trailblazing people. Even if it doesn't help me today, it will help my kids, other people's kids, and my family.
Faith, and but we believe in so much or so many other things that I don't know where this falls on a line of anything else. And one analogy that I think about, is when we take our car, we buy a new car, we have no doubt that the safety measures that should have been done to assure that vehicle is safe. And you can't compare a life with a vehicle, but it's still the same process. If the car isn't meet a certain standard, then you can have an accident that can also take your life. So, a standard has been met here with the vaccine. At least I believe that it has. And as we trust in those other standards to be met, and we are okay with proceeding with, buying a new car or getting our car serviced, then why not, trust in this process to assure that our health is going to be secured as well.
My own emergency staff has had a lot of doubts and a lot of hesitation. The question, because they've asked me multiple times, am I going to get the vaccine? And I'm like 100% yes. Looking at not only the data from the multiple studies that have been done that shows a really good safety profile, also looking at the effects that we've seen from COVID itself and kind of weighing those risks and benefits. The risk with getting the virus itself is, I think, in my mind, much higher than getting the vaccination.
I am in my 40th year of nursing, and it's the best job in the world. I feel like I've been honored and privileged to be a nurse this long, and I now feel it's my duty to show everyone else that this is a safe vaccine and that it is going to be good for our country.
It is not a pretty sight, and it doesn't make, I don't like to think about it too much because it's not very comforting. It doesn't make me feel good, except that now we have to be, and I have to be, let me personalize it. I have to be, father, mother, son, daughter, brother. I have to be everything to that patient every time I go to see that patient. You know, me along with my colleagues, you know, the nurses, doctors, we all do our part. But a big part of that is just being there, touching them, talking to them, encouraging them. You know, so this vaccine will ensure that I can continue doing that and do that without that fear, you know, of, well, am I going to catch it? You know, I prefer to take this 95 to 100%. It's in my back pocket. I'm good to go.
Yeah. Say it's very difficult. Yeah.
Yeah, I love my job.
Mm-hmm.
So, and I gotta be safe and be safe for home.
My experience, oh my gosh, nothing has been like this. 2020 has been awful. Patient with COVID, it's such a painful experience for providers, seeing your patients hurting, seeing them struggling to breathe, watching my 45-year-old saying to me, am I gonna survive this? I wanna be able to go back to my wife and to my kids. And then having seen him go on vent machine an hour later, having seen a 37-year-old die from COVID with no medical history, it's been awful. Coming to work every day, worried about how can I comfort my patients? How can I be able to reach out to them and heal their sickness? And being so helpless when I see them dying because nothing is working, it's been awful. More than that, making that phone call to families who cannot come in and see their loved one and giving them reports every day, hoping I can say it's getting better when it's not, and I always have to say we are not doing well, and that was very heartbreaking. So with vaccination, I feel like we have a hope to put an end to this awful disease. It's been a terrible year, and it's not over yet.
About April, May, I started getting nightmares and stuff about my job, and it was very stressful. So this is actually my first job as a nurse. I kind of handed a handful in the process, but yeah. A lot of us were having like nightmares and stuff around that April-May range, that first wave. It's gotten a little better since then because they've gotten a lot better at treating it. But still, would really like to not have to wear my spacesuit. We've seen a lot of people pass away, and it can be extremely bad. Definitely not something I want to experience myself, and something that I would like to not have to deal with anymore.
I see it every single day, and I see it multiple times a day. It was really excited that there's kind of, although there's no light yet, there is a tunnel that we're seeing.
Vaccination is not new. We're gonna do that not just for ourselves, but for our aging parents. Because you may get COVID and you may be okay because you're young and healthy. You're gonna do it for your aging parents. You're gonna do it for your cancer patient. You're gonna do it for the immunosuppressed patient. You're gonna do it for the 200,000 people who had died from COVID and their pain. You should not be undecided. We should do it for the whole world. It's not gonna be all about us. It's gonna be about people who are out there that are gonna hurt more when they have COVID and may likely die from it.
Consider the alternative. If you don't take this vaccine, then what? Are you prepared, and is that level of risk acceptable to you? If it is, fine. For me, no, it wasn't acceptable. Knowing that there's a vaccine out there. Is it 100% foolproof? No. But then again, nothing in life is 100% foolproof. So I am comfortable with the product. I'm comfortable with the decision, and I'm happy that we finally got it. And I jumped at the very first opportunity to get it.
I, as a minority physician, that has really looked intently into the data. It looks very safe, I think, and I recommend it for all of my family members, especially considering we, as a minority group, are of higher risk in getting a lot of these the really bad effects from COVID-19. We should be very aggressive about getting ourselves vaccinated.
We listen to all the naysayers, and all they say, don't do, don't do, don't do. And they give you the reasons why. This is what has historically happened. I got it. I understand what happened. Tell me, please, tell me, what should I do? You're telling me what not to do. Tell me what to do. And I haven't gotten an answer. I understand fully what you're saying, and you're justified. I understand. There's no disputing it. It happened. Documented. Notwithstanding. Good. This is 2020, and we're dealing with real life, current affairs. Tell me what to do. No one has come up with a better solution, a better answer than take this vaccine.
There is no color related to COVID. We are affected more than our counterparts. So I would say we, if anybody, should get the vaccine quicker than the next person. We are the ones who have been affected, our areas, our communities. I would say I took a step out on faith. Every family member that I have, if they have the opportunity to get the vaccine, I'm going to encourage it, because without us, it's not going to happen. This is nothing like before. I know that there's social media, there's other things that are trying to deter people. But when we mix these vaccines, we do not know who is getting this vaccine. There's not a vaccine for a colored person. There's not a vaccine for a non-colored person. The vaccine is the same vaccine in a lot number. We are all getting the same.
I'm excited to go out and tell my friends I did it and you can do it.